Hey everyone. I wanted to talk a little bit about nervous system, specifically as it pertains to those of us who are in survival mode or those of us who have ADHD. And the reason that I want to be really specific about that is because I've been in some groups and I haven't been in them in a long time. Recently come back a couple of months ago because I had some friends in the group and they were saying that, I might be able to come in and shed some light on some things and maybe offer some perspectives that we're not really seeing with the typical med route and the typical therapy route. And so I really wanted to come in and talk a little bit about today, specifically nervous system repatterning and something that we call neuroception. So, what that is neuroception is one of the senses that we feel in our body. It's similar to touch and taste. Neuroception, though, is the one that senses danger. So if we're walking into a crowded room of people, we can immediately sense, is this a safe place or is this a dangerous place? And so that is our neuroception. Those of us who have a nervous system that is chronically dysregulated will have a harder time sensing safety. We often will perceive a higher threat of danger than those of us who have a nervous system that is very calm and well regulated. So I wanted to talk a little bit about how we change our neuroception and is there even a way that we can do that? So the answer is yes. There are a couple of ways we can do it, but the first thing that I want to talk about is what is our nervous system, and what am I talking about when I talk about dysregulation? So our nervous system is the autonomic nervous system, and what that is our amygdala senses. Sort of assesses the situation. It's constantly looking around, and it assesses the situation for relative degree of risk. For those of us who have ADHD, we have a chronically high dopamine state. We have a really hard time breaking down the molecule that of our neurotransmitters called dopamine. And so often when we were little, we got in trouble a lot, right? And so now we're constantly assessing our situation, figuring out how do we have to react in order to stay out of trouble. And so that puts us into a state of fight or flight a lot. And in terms of our nervous system, and I explain that in terms of a polyvagal ladder, that is our sympathetic state. It's a stress response state that tells us that we have to do one of five things: fight, flight, freeze, fawn, or flop. So it's going to get us into a state of doing battle. So it's going to take resources away from extraneous body processes. So our breathing is going to get faster because we might need to run or fight. Our brain is going to remove all of the higher thought processes and just go into lizard brain because this is where we can most adequately prepare to defend ourselves, right? In whichever way that we choose is most appropriate for the situation. So when we're in fight or flight, we're not really thinking very clearly. We have a hard time communicating verbally. We have a hard time making a plan and sticking to that plan. For those of us who are ADHD, for those of us who have a really maybe a negative self-image based on a lot of the programming that we had when we were children, being told, "Well, you're too loud, you're too lazy, you're too much of a daydreamer, you're not going to amount to anything, you need to put more focus onto this, that, and the other thing," then we have a heightened sense of fight or flight, a heightened sympathetic nervous state, because we're constantly watching for things that we're doing wrong because we're used to getting in trouble so much. So the other state of stress response state is a what we call dorsal vagal, and that is shutdown. And so once we've been in fight or flight for so long, and our bodies just can't take anymore, we go into a state of just collapse, and that might look like um, sorry, that's my dog. What that might look like is scrolling on our phone or mindless eating or watching our favorite comfort show. And basically, it's when we have just sort of capitulated. We believe that we're in imminent danger. There's nothing that we can do in terms of fighting or fleeing. And so we just collapse. And oftentimes when we're in survival mode, what happens is we're bouncing back and forth between fight or flight and collapse. And we're having a really hard time getting to the top level of the autonomic nervous system rung, which is called ventral vagal state. And that is our rest and digest state. That is the state that we're in when we're calm. We're having a nice conversation. We're engaging in our passions and we're finding our joy. For those of us who are in survival mode, it's really difficult for us to get to that state anymore. And so as hard as we try, we're really just stuck in those two nervous system states and we just kind of bounce back and forth like a ping pong ball. So how do we get out of it? Well, that's a really good question. There are a couple of things that I do in my practice that involves neuroplasticity, which is our thought processes. It involves neurotransmitters, which is our chemical balance. We want to increase our serotonin so that it naturally decreases our dopamine. But that's not the one that I want to talk about today. The one I want to talk about today is neuroception, which I mentioned earlier. And what we do is we utilize something called the vagus nerve, and that's how we tone our neuroception. So we can do a lot of things. One of the things that a lot of people do is singing or gargling or just being able to open our vocal cords. Our vagus nerve innervates in around here. It is the largest of our 10 cranial nerves. It controls a lot of systems in our body, like our heart rate, our breathing, even our GI tract. So it's very important that we bring this back in tone. And so we can do that through lateral eye movement exercises. It's something that I demonstrate over on my free Facebook group. I'll link that down below. We can do it through breathing, and this actually might be one of the easiest ones for us to incorporate right off the bat. So I'm not talking about Wim Hof here. You can do that later once you're feeling a little bit more stable. But right now, what I'm talking about is just making sure that your exhale is longer than your inhale. And this seems really simple, but what it does, it sends a cue to our bodies that there is no danger. Because if there were actual danger, we would be bringing in more air than we're releasing because we're trying to run, we're trying to fight, we're getting away, right? So if we're able to release air longer than we pull it in, that sends a cue to our body that there is no danger and that we can relax and be safe. So what else do I talk about? In my group, I talk about neurographics, which is kind of a combination of neuroplasticity meets art therapy. And that is a really great way to restabilize and re-regulate our nervous system. And then, of course, the big one that I talk about in my group and that I use with my private clients is something called Safe and Sound. And that's a polyvagal listening program. It is the best of its kind. It's the fastest, it is the least effort, and it is by far the most effective. So if you want more information on that, I'm happy to supply it. It is a really wonderful, it's what helped me the most. It's what helped my daughter who's ADHD, my husband who is autistic with a PDA profile. It helped our whole neurospicy family. So yeah, if you want the quickest route, the most gentle route, I'm happy to give you more information about that. But honestly, I'm happy to talk to you about any of this stuff. What I really want to do is change the narrative on the idea that we're just stuck where we are. We're here and there's no hope for us to get past it because all we have is medication and therapy that's kind of helping us limp along but not really getting to the root cause. So if you have any questions, if there's anything that I can help you with, I don't have all the answers, but whatever answers I have, I'm happy to share those with you. So please feel free to reach out or leave a comment on the video or come on over and join us in the free Facebook group. I'd love to meet you there. Thanks again for watching, and I hope you have a really great day.